So today we're going to do the techniques on the spine and thorax. So this is just a lecture part. Then we'll do hands-on. So for you, those that were here yesterday, we went over some of the bones of the spine and thorax. Well, not some. We went over the bones. So you guys are going to need to be familiar with the thoracic spine, the lumbar spine. It's not on here, but the cervical spine. You need to know the anatomy of the sternum and the ribs. Now remember, there's 7 true ribs, 8, 9, 10 false, the last 2 floating. Cool. Palpation techniques. These are basically the same for every body part, but begin with gentle contact, deepen as tolerated by the client. Ask how the pressure is as well. Compare bilateral sides for alignment and tenderness. Not all bodies are created equal on sides.
I'm totally equal.
Kiki's equal. She's the perfect specimen. Palpate during movement. This is a fun one. So it's a little difficult to palpate the spine during movement because they're laying in an erect position. Flat, I guess. It's erect but flat. So some of these moves would be easier if the client was maybe sitting on the side of the table, but we don't do that often. But you can do stretches and put them in side lying or different positions to stretch certain muscle groups. Use broad strokes versus pinpoint contact depending on the tissue. So for the tinier areas, you're not going to be able to do broad pressure. But the back is not a tiny area, so start broad and then work your way to those more pinpoint, trigger point techniques. So these are the superficial postural muscles. So a posture muscle is in charge of keeping your posture and you're not thinking about it. So this would include on the back the erector spinae group. Remember the 3 erectors that we talked about yesterday? One was the spinalis that was along the spine. One was the longissimus that connected a little further out on the transverse processes. And then your iliocostalis would be towards the ribs, where they connected on all the ribs. Remember? Yes. Then we have something called the latissimus dorsi. This is a very big back muscle. It is referred to by people as lats. It is the main swimmer's muscle, and so on. The trapezius is part of the back because the trapezius can pull on the cervical spine. So there's that. Rhomboids. So those are between your shoulders. They tend to pull on your scapulas, but they are also a postural muscle as well. And here's a fun picture if you need to zoom in and study it a little bit to kind of know. There's also some rotator cuff muscles and other muscles thrown in there too. Ooh, baby. It's because it's not important.
Okay. Yes, it is. Every muscle is important.
It's all important.
Yeah.
Unlike the appendix.
Or the gallbladder.
Or the gallbladder. Forget you, gallbladder and appendix. So those were the posterior or the superficial postural muscles. These are more of the deep muscles. This would include your rotators. So the multifiduses or multifidi, the rotatores. So remember that. I'm going to zoom here. Multifidus along here, and then you have all the tiny rotatories, so the crisscross type stuff. Because they not only do they extend your spine, but those 2 muscles also help with rotation at the point that they are located. we're going to learn about the QL. I'm going to teach you guys how to palpate the QL. That is called the quadratus lumborum, QL for shorts. This muscle primary function is for side bending. It also anchors the ribs when breathing, but this little sucker, sometimes when it's tight, can pull your hip into an elevation. So this is a really good muscle to get to, hard to get to because it's so deep in the body. But if you do it right with precision, you can kind of help that person to open up that QL in that side region to help with side bending and possibly bringing that hip down. We're going to go more in detail about the QL when we talk about the pelvis too. Then you remember your serratus anterior that wraps around the ribs, like if someone were to grab you like this. Well, you also have a serratus posterior. This is on the back of your body. So the serratus posterior, you have a superior high fibers, and you have the inferior, the lower fibers. And this is what the direction of those fibers are. So here's your superior, and then your serratus posterior inferior. So below. And those muscles all here will help with posture. So if you have dysfunction in any of these muscles, you might have bad posture or an injury. So there's some common conditions with the thoracic spine, which include, but not limited to, kyphosis, scoliosis, and something called costal vertebral joint irritation. You're like, what is all this? So we are going to be learning about these things in the communicable diseases, which is basically pathology class. But remember, kyphosis is a exaggerated curve of the thoracic spine. It already is called a kyphosis or a kyphotic curve, but when it's exaggerated. Here's a picture here of scoliosis. I liked this picture because it shows how not only the dysfunction of the spine, but it shows how it's pulling on the rest of the body, and see how just this curve can cause issues with all those back muscles. And you see how the pelvis is tilted. So when somebody does have scoliosis, they're not just having back pain. They're having all kinds of pain. And I think they're used to it at that point. Their pain tolerance must be pretty high. So the costovertebral joint irritation, break up the words, guys. Cos means ribs. Vertebral, vertebrae. So the joint between your vertebrae and where your ribs connect can become irritated or inflamed, and it can cause tenderness where the ribs attach. If they have tenderness where the ribs attach, you're not rubbing it. You can work around it, and as we learn more about modalities, we can do something called myofascial release, which is kind of doing a full fascia stretch in that region to kind of free up any restrictions. So common lumbar issues would be a low back strain. This is typically your erector spinae group, and then it would cause guarding with other muscles. So that's why when someone has pain in one area, it might not be the source of the pain. Remember, there's referred pain, or other muscles might be jumping in to stabilize or do that action because the other one's weakened. Excuse me. Then we have lumbar disc herniation or bulging. So any disc issue could happen anywhere on the spine. Cervical, thoracic, lumbar. Lumbar is like a good spot where most of it happens. Can cause localized tenderness along the paraspinals, those muscles along the spine, and other referred pain. Then we have, this is a mouthful, spondylolisthesis. Spondylolisthesis. Say that 10 times. This is when, I'm going to show you here. you have a slip in the vertebrae. So that sucks. So it could be from degeneration, injury, whatnot. So what's happening is the discs are, the two vertebrae, top and bottom, aren't lined up like they should be anymore, and you have a disc slide of some sort, or a vertebral slide. So that's what's happening here, and imagine all those muscles that are trying to keep that spine where it's supposed to be. Those are all going to be really irritated. The nerve is going to probably get pinched and irritated. So any area of the body that's being innervated by the nerve that's at those specific discs, there might be an impairment, dysfunction, or paralysis. So that could be muscles, anything. All right, facet joint irritation. So your facet joint right here on the side of your vertebrae can become inflamed because it's a joint. Joints can be inflamed. So that would cause a lot of pain. Say the massage isn't helping, this is when you start referring out. When someone is having spinal pain of some sort and the massage doesn't help, that means it's not muscular, not like primarily muscular. Because I think any injury always has a muscular aspect to it, which is why I think massage helps a lot of times. But at this point, they're going to need further help than we can do. Sacral. Now, I'm stopping at sacrum. I'm not really going into the pelvis much because we're going to cover that at a different chapter. So the SI joint dysfunction kind of goes along pelvis and sacral issues. I'm going to zoom here. Remember yesterday I said the SI is where the sacrum and your hip bones attached, your iliac or your ilium. So there, since this is a tiny little joint, it doesn't have the same motion that you would think other joints in the body do. There's very, very little movement with the SI joint. It's not meant to move a lot, but it's meant to just have a little bit of a fluctuation, just tiny. But since it is a joint still, you can get issues with that. There can be an alignment issue where the chiropractor is like, oh, your SI joint was out. So lots of inflammation can happen at the SI joint.
Is that a synovial joint? Is that right?
Synovial?
Yeah. Because isn't that what the joint on the clavicle is? Is a synovial?
I need to look that up. I don't think it's a synovial joint.
Okay.
Let me look it up right now. It's a good question. If it is, then I'm wrong.
I was thinking.
It is considered one.
Really?
Wow.
Because there's no actual, it's just two bones, like.
It is
bumping
two
into each
bones,
other.
so it's going to
So,
need some kind of lubrication.
Is there like maybe a bit of bursa or that synovial?
Good question. Yeah. You're so smart. You are so smart. So yes, it is a synovial joint. Well, I'll be darned. So when someone has SI joint dysfunction, there's going to be tenderness near something called the posterior superior iliac spine, which you guys don't know what that means yet, and we'll learn that when we do the pelvis. And there usually is some issues with your asymmetry, so it's not going to be quite even on both sides. A lot of times SI joint dysfunction also goes along with a pelvic tilt, either bilateral or unilateral, maybe something called an upslip, which is also an elevated hip. Two of the terms that mean basically the same thing. So the SI joint dysfunction is hard to treat. Sacral iliitis. So this would be swelling or pain with palpation and movements at the sacrum. Does that make sense? Itis, sacral. Okay. Coxagodynia or dynia. This is point tenderness over the coccyx. The coccyx is your tailbone. So we're throwing that in with spine because it is at the end of the spine. So you can have issues with this coccyx. You can fracture this coccyx. Oh, I bet that hurts. You can bruise it, which I've done before, falling on my butt down a flight of stairs. Typically, if you're going to do some kind of damage or injury to the coccyx, it's probably going to throw your sacrum out of alignment. You're going to have SI issues, all that fun stuff. So be careful. It's funny when people fall, but it's not funny when they're hurt. All right, some common rib cage and sternum conditions. An easy one, rib fractures. That can happen with any blunt trauma, or if somebody's very, very fragile bones, and they do something stupid, or not stupid at all. Then we have costochondritis. So this is pain, costal, cartilage. This is pain and inflammation where the costal cartilage connects to sternum and other areas as well. So respiratory restrictions can cause issues. So if there's reduced rib motion, it could affect breathing. Okay? A man? All right, so your ribs, the tiny little intercostal muscles can become tight and tense, or your fascia around your ribs can be, we'll call it like a steel web instead of nice and fluid. When that happens, it's going to cause you to not be able to take deep breaths. So it could be caused from scar tissue, any kind of respiratory disease as well. So we can actually go in and work between the ribs very gently. And when we can also do a diaphragm release, which I want to show you guys. I'm going to write it down. Diaphragm. Diaphragm release. That's fun. I'm trying to write in like not all caps just for fun sometimes. It's good. Red flags. Severe pain with light palpation on the ribs or the spine. Any recent deformities. If somebody noticed that something started to become deformed for no reason, that's a red flag. Okay. So that might indicate a very, very, very bad disease for them. Swelling or bruising after trauma. Typically, we're not going to work on the affected area if it's bruised and swollen. We can work around it, but also depends on how much area is swollen. We might have to avoid that area altogether. Or maybe somebody can't lay down because of so much swelling or bruising. At that point, you would just reschedule the appointment until they are feeling good enough to receive massage. Neurological symptoms. If there is numbness, weakness, tingling, refer out to figure out why there is a nerve being pinched or where it's being pinched. So remember, numbness, weakness, and tingling tend to be nerve related. I thought this was a cool picture. This guy looks serious. So today's lab, we're going to partner up with the Wheel of Doom. And I want you to, if you didn't do this yesterday, since we made it a quicker hands-on experience, palpate the spinous and the transverse processes if you can. Now, it's a lot easier to palpate the spinous process because you can feel kind of the bumps. Trace the ribs, their angles. Don't trace the sternum. That's weird. You can try if your client today is okay, if your partner is okay with you doing some palpation on the sternum so you can kind of feel what different sternums feel like. But make sure they're okay with it. Some people don't want their chests worked on. And obviously for the women, breast tissue, stay within the realm of the bone and don't veer off to the lateral aspect of the chest. Keep everybody covered also. I feel like I shouldn't have to say this, but you know. We're not doing the location of the PSIS right now, but you can feel around the sacrum if you would like to on your person. Not the coccyx. Do not try to find their coccyx bone. There's adjustments for chiropractors at the coccyx adjustment, internal and an external release. I had a chiropractor that said that he had someone that would always request internal in his previous practice, and he's like, I had to stop seeing them because I was so freaked out every time I saw this person. I'm like, that's really funny. All right. I want you guys today to try to feel the erectors up the spine. So try to find the lamina groove on the outside of the spine and just try to feel. Some people have stronger or more taut erectors, and you just touch it and it feels like you want to cut them open and have a nice steak. Sorry. No, don't do that. That's cannibalism. But I want you guys to kind of feel around mainly the erector muscles and try to feel between the ribs. And I'm going to show you a little bit more on how to do rib work with the hands-on, whoever is going to volunteer for that. Just be very gentle. It hurts to rub the ribs. There's not a whole lot of tissue surrounding it. So just be very careful there. All right, here's my references for the internet. There you go. Booyah, baby.